Good afternoon, it's Dr. Larson talking about COVID-19. So I'm going to touch base on a couple of things today. I'm going to talk about our new variant, Omicron. I'm going to talk about boosters, which is probably the most important thing. And I'm going to talk about Christmas. So Omicron, first found just a couple of weeks ago in South Africa, but as you've probably seen in the news, it is in lots and lots of countries. There's a lot of things we don't know about it yet. What we do know is it's very, very infectious. So effective reproductive number 3 to 3.5. What that means is that for each person that gets that particular variant, they are going to infect 3 to 3.5 other people. So very infectious. We're seeing that happen in the United Kingdom now. If you want to see what probably is going to happen with us, follow what's happening there currently. What it does not appear to be is it does not appear to be cause more significant illness. And we'll just have to see over the next couple of weeks about hospitalizations and deaths. In places like South Africa, they are hospitalizing a lot of folks 50 and under, but they're not requiring as much oxygen, they're not requiring as much ventilation, to being on ventilators, I mean. So it appears to be less serious but more contagious, and we're just going to have to see over time. The vaccines are still working for this new variant, and it's really important that we all get our boosters. It's unfortunate that we've kind of locked into our heads that 2 doses of the Pfizer or Moderna vaccine or 1 dose of Johnson & Johnson vaccine is fully vaccinated. That is not true. We're calling them boosters, but what we really should probably be considering is that they are a 3rd dose or a 2nd dose of Johnson & Johnson of a series, and we need that 3rd dose. We've had waning immunity and we have new variants coming along. So everyone up to this week, 18 and older, should get a booster. Up here on the wall it says we only have 17% of people in Kittitas County that have gotten their booster vaccine, which means that there's a lot of people that are at risk for breakthrough. So earlier than this week, it was everyone 18 and older should get a booster. Now this week it's been approved for adolescents 16 and 17, they should get a booster. So if you are 16 and older in Kittitas County, you should be getting a booster of your vaccine so you are safe. You're protecting your elderly relatives. They're the ones that are mostly at risk, and we're keeping schools open and keeping people from overwhelming our healthcare system. The healthcare system is still really busy. If you have an opportunity to thank anyone that works in healthcare, please do that. They're working really hard, and they're not just seeing people with COVID. I worked at the hospital last week, and it took me 4 days to transfer somebody out of the hospital to a different hospital that needed a procedure done. This person did not have COVID, and it's because all of the hospitals in Eastern Washington were full. So we can do our part to protect everyone by getting vaccinated, and that's my ask for Christmas this year, is please get vaccinated. You have time before Christmas to get some immunity. Encourage your family to be vaccinated and be safe over the holidays. Thanks a lot.